Hi, this is Gail Jaffe from SPRC. Welcome to today's webinar. I wanted to let you know that we are going to wait another minute or two before getting started, so you will hear silence. But I did want to also let you know that today's webinar is being recorded, and I will be back in another minute or so, and then we will get underway. Thanks. Hi again, this is Gail Jaffe from SPRC, and we are going to go ahead and get started with today's webinar, even though I realize that a few people probably will be joining us as we get underway. But I did want to welcome you to our program today. We're going to be talking about engaging and motivating gatekeeper trainers and trainees with a focus on strategies for sustainability. So it is great to have you with us. We are looking forward to having our own engaging and motivating conversation with our panelists and would really welcome questions and comments from you throughout, and I will show you how you can go ahead and interact with us that way. So just to give you an overview of what we're going to be talking about during the webinar today, I'm going to do a little bit of a brief introduction to me and to our other facilitator, Carrie Smith, and then a little bit of an overview of the Q&A function and how to submit your questions and your comments for anybody who's not familiar with using the live meeting platform. And then I will just introduce the topic itself and talk to you a little bit about who's with us for panelists. Carrie and I are going to then be discussing with the panelists a number of different questions that are really generated to talk more about the different strategies and challenges that people have run into when thinking about engaging and motivating gatekeeper trainers and trainees. And then we will have a longer period at the end for any additional questions and comments and discussion that you might have. So this is a little bit of a visual cue to help you match some faces to names. Like I said, I'm Gail Jaffe, and I'm a Senior Prevention Specialist at SPRC. And joining me today is Carrie Smith, one of our campus prevention specialists, and you'll hear her voice in a moment as she gets us started with the first question.
Hi, everyone.
There you go. You just heard her voice now. And like I said, just to give you an idea of how to use the Q&A function and also raise your hand using live meeting if you're not familiar with the platform, this image towards the bottom will show you how you go about asking a question by typing your question into the Q&A text box that you'll be able to access in the upper left-hand corner of your live meeting window pane. And then within that, you also have the ability to raise your hand if you have a question by clicking on the image of the hand, and then one of us would initiate a one-to-one chat with you. And if you're running into any kind of technical support with live meeting, then there is support available, or if you're running into any technical issues, I should say, with live meeting, there's support available by telephone and email. The URL is displayed on this particular slide, and it is www.livemeeting.com/ask. And then there's a toll-free number which I'll read out loud in case you have had difficulty logging in. It's 866-493-2825. And again, that's 866-493-2825. So again, with the visual aids here, wanted to give you a way to match some additional faces with the names and voices that you'll be hearing during today's webinar. And I will just go through and introduce each of these panelists to you. And I should also say that while I'm going through these introductions, please keep in mind that all three are fairly accomplished in their particular positions in the field, and so I've shortened their bios quite a bit here just in the interest of time. So first we have Matt Berry, who's joining us, and he works with Worcester Polytech Institute's Student Development and Counseling Center as the outreach coordinator there. And he's responsible for the coordination and implementation of programs and trainings for WPI students, such as the Student Support Network Peer Program, and that program was recently added to the SPRC and AFSP Best Practices Registry. So welcome, Matt. Maybe we could hear your voice?
Yeah, no problem. Here is my voice.
Great. Thank you.
Yeah.
And next we have Mark Wilmurray with us. And Mark is the Executive Director of the Sources of Strength program. And he has about 30 years experience working with adolescents and families in a variety of settings, including juvenile justice, mental health, faith-based, and population-based public health programs. Sources of Strength is also in the Best Practices Registry, and it's a program that connects peer leaders and trusted adults in suicide prevention. And along these lines, Mark presently is partnering with the University of Rochester in the National Peer Leadership Study that's funded by NIMH. Mark?
Hi, everybody. Good afternoon.
Thank you. And last but not least, we have Donna Noonan joining us. Donna is the Youth Suicide Prevention Coordinator for the Oregon Public Health Division and coordinator for the GLS Grant Project in Oregon. She oversees subgrantees in 20 counties to implement youth suicide prevention activities, including Gatekeeper trainings, specifically QPR and Assist. And Donna has spent over 25 years working to prevent high-risk behaviors in youth and public health settings at the state and community levels. She herself is a certified suicide prevention Gatekeeper training in QPR and an Assist master trainer. Donna?
Hi, I'm happy to be here. Thank you.
Great, thank you. And we're so glad to have the three of you with us today and think that it's going to be a really, like I said, engaging and motivating conversation about Gatekeeper and key leader trainers and trainees. So before we launch into this first question, which Carrie is going to get us started with, I did want to mention again that today's webinar is being recorded and it will be archived. So you don't need to necessarily worry about taking notes as we go along if you're looking to just listen into the conversation, because we will be archiving this content. So Carrie, do you want to get us started?
Great. Thanks, Gail. Hi, everyone. Thanks again for joining us. So I'm going to start off with our first question to our panelists, but again, feel free to enter any questions you have in the Q&A chat box, and we'll be sure to try to address those as well. But so to our panelists, our first question is, what has been the biggest challenge for you in keeping trainers or key leaders engaged in your program's suicide prevention efforts, and how have you taken steps to overcome this? Maybe Mark, if you could start us off.
Sure. Well, I think, one of the things, I guess, describing sources of strength is a little different than maybe, a typical Gatekeeper program. What we do is we're working in middle school, high schools, and college-based settings, as well as faith-based and community settings. But we try to really kind of train a group of adults that are going to mentor and work with a group of peer leaders that in turn go out and do a whole series of action steps and what we call hope, help, strength messaging activities. So I think, as I think about that is I think one of the biggest challenges is getting the right people in the right role, and so that they've got the right skill set. And whether you're dealing with trainers or peer leaders, I think, really being able to help them clarify kind of expectations, what are the things that they can do, and then really trying to provide good support. And I think especially ongoing support is really important, not just doing kind of a one-time training, but we've really found that we've got to provide kind of ongoing things. And so, and I think, one of the things that I've noticed in our suicide prevention work, and particularly in sources of strength, is that we've got to have a variety of opportunities for folks to be involved, really based on their skill and comfort level. And our training that we do with our peer leaders, it generally is about a 4-hour training, extremely interactive, just about no lecture. We don't use PowerPoints, anything like that, a lot of game types of things. So, somebody that may be a good gatekeeper trainer that went out and would present something that was more lecture-based on a PowerPoint platform, they might be a good presenter in that, but they may not necessarily be the one that can go sit down with 50 to 60 teens and do a really fairly fast-paced, interactive, leading games and discussions and debates with 50 teens. And so I think a big part of it is looking for the right skill set for the type of trainers that you have or the type of training that you're presenting, and then really putting energy into kind of supporting and building those skills up and giving them support as they're doing that.
Great. Thanks, Mark. Our other panelists?
Our biggest challenge in Oregon has been having people take a training of trainers and then not follow through. That's one challenge, and then another one has been when trainers are trained and they don't have an agency, they don't have their own constituency, and they don't have agency backing for helping them to set up trainings and support them in giving those trainings. So what we've found, particularly for ASSIST, which is much more expensive, is that we screen applicants when we're funding a training for people to attend a training for a trainer for ASSIST. We ask for applicants and have some requirements that they have to meet, that they've at least attended the ASSIST training, that they've got experience and skill training in something like a 2-day training or something that is so already set, this is how you train it, and agreeing to attend the 5-day training. There are some other ones as well. What's their experience of training? And we don't always stick to those. We've had some really wonderful trainers come in and say, I want to be an ASSIST trainer. They've never attended an ASSIST training themselves, the 2-day, and their motivation and their skill set makes it so that they can also become really great trainers. Then we also require a certain number of trainings of the people that we pay for within a certain period of time. Last time we required that they do 4 ASSIST trainings within 2 years. We provide support for them. At the counties, they help them. Often they'll have more. They'll have 1, 2, 3, 4 trainers in a county, depending on the population. So they support each other and they get agency support that way, and they're really connected locally, which is easier in some ways than when the state is paying for trainers and they're not connected with our agency, but they need also to have the agency support of where they do work. Sometimes giving trainers stipends for travel and training, that's particularly true in the QPR trainers in the counties, that they have time to do the travel, they have time to do preparation, and they get just maybe $10 or $15 an hour to do the preparation, to do the work, and to deliver the training. In ASSIST, it has become recently part of their job that the new trainers counties have been getting have been employed at the county agency, the mental health agency, the county health department, or a school district that they're working with, and the training in some cases then becomes part of their job. In other cases, the county will actually pay the trainers to deliver the training, or they'll ask them to deliver the training at no cost for a certain period of time, and then or for a certain number of trainings, and then once they've done those, say, 3 trainings, they can charge, and the agency will continue to support them. And if the agency helps to set up the trainings for them and do the registration and give them a lot of support that way, it's very, very helpful.
Great. Thanks, Donna.
You're welcome.
And Matt, did you have anything else to add?
Sure. I mean, I can talk a little bit about, kind of our situation, our challenges, and I think, being a college campus, we've got some, for example, we're surprised if any of our students that we train are going to be around any longer than 5 years at the outside. I mean, ideally we want them to graduate. So we kind of have, planned into the program the fact that there is going to be turnover. We're not training people to stick around, forever for years and years. We try to train probably anywhere between 30 and 50 students a semester, and the training we give is a 6-week training, so we get a chance to build a nice personal connection with them, get to really know each other. We can kind of leverage that personal relationship to maintain an involvement over the time that they're at the college. But one of the advantages of kind of training in these larger groups is that we ask very little responsibility-wise of the students who receive the basic core training. We really want to more be supporting them as their friends are coming to them with issues, as they kind of come across things and are wondering, what do I do with this? So we're providing them with the support. And from this larger group, some of which we only see very infrequently. We only see them maybe certain social type events we hold to keep people involved. They're not coming to a lot of the more advanced trainings we hold or joining our more traditional peer ed groups once they've been trained. But, we've got them out there. We know that they have been trained. We know that we do have a relationship with them. When something comes up with their friends, they know they can come to us. But out of this larger group, there's a percentage that wants to be more involved with us. They're the ones that we find that this is a really great fit. And those are the ones who wind up being like, the presidents of our sexual assault peer ed groups and our Asperger's peer mentors and things like that. So our main training, our big flagship student support network program, becomes a feeder for these other programs and initiatives that we try to do, and feeds the involvement that way. And we really try to make the student support network thing an identity piece for these students. It's not just a training that they do when they're done. They kind of, they get a sweatshirt that has it on, they wear it out campus. They know there's other people involved, and it becomes an identity piece, and then there's some buy-in to that.
Great. Thanks, Matt.
Mm-hmm.
Neil, did you want to move us on to the next question?
Sure, I'd be happy to. So this next question is sort of specifically geared towards Mark and Matt, and has to do with peer-to-peer based programming. Essentially, what would you say is the hardest part about engaging program participants, in this case students and youth, and which strategies have you used to keep them involved and motivated? And either one of you can get us started.
Okay, I guess I'll just keep talking then.
Okay.
So, one of the hard things I think to overcome, and it's getting easier and easier, I think, every year, thankfully. I think there's still going to be some stigma around, mental health issues and involvement with the counseling center. And I think the strategy we've used for that is to just, for our part, be as visible, be as present on campus as possible. We really try to do a lot of outreach besides just this program. We go out and we do stress management workshops, time management workshops, team dynamics, stuff like that. And we really try to connect personally with a lot of students. So, so we try to be known on campus. And the more that people kind of see us as approachable and, we're not hidden off away somewhere, I think the less stigma there is in being associated with the people from the counseling center and doing something involved with that. We also really want to try to tap into what are the existing mindsets and priorities of the students. And I think, it just comes back over and over and over that, kids care about their friends. That is the focus of their world. And so our program speaks directly to that. It's meeting a need that they have where they want to be good friends, and they want to understand what to do when their friends are concerning them, when they're bringing them some heavy stuff. And so we try to speak directly to that need, and not just with the training. In the marketing we do for the training and the messaging that goes out, we try to be very clear and very consistent with that message that this is what our program is about. It's about helping your friends. It's not about giving you new extra responsibilities on top of your already very busy lives. This is about, we identify, we hear that this is something you need from us, and we want to provide it to you. And I think that, I think it resonates. I think they really, they hear that, and it's something they want to be involved in. It's something they want to stay involved in. And then there's the follow-through. Once the training is over, we maintain that relationship. We maintain that support. We're constantly sending emails out to all the students who have been trained whenever there's been things that have happened on campus. Unfortunately, last term, we unexpectedly lost a student, passed away, and we sent an email out, is everyone doing okay, to the Student Support Network, and saying basically, keep an eye out, keep your ears open, watch your friends. We're not asking you to go out and do counseling for us, but if you see anyone who looks like they're having a tough time, reach out, and if appropriate, hook them up with us. So this is kind of the role that we're putting them in, and I think they feel valued and appreciated, but I also think they feel supported.
Great, thank you.
That
Mark?
sounded great. I guess I'd echo a lot of what Matt said. In sources of strength, one of our strategies, of course, is we're trying to recruit a diversity of peer leaders that can kind of reach into all the different cliques and groups, say in a high school, middle school, and depending on the focus in the college, we may be trying to reach into a really broad base throughout a whole variety of college students. So we would be trying to kind of recruit peer leaders from a diversity of those, and not just getting kind of all the honor roll students, but that we've got a good blend, and some of the peer leaders might be a bit more kind of edgy, that they might be ones that haven't been picked for a lot of peer leadership type of things before. And actually, our experience has been, it's usually not been as challenging to recruit peer leaders. On the whole, we find that they're pretty hungry to have a meaningful impact. And our focus is really kind of bring peer leaders together with trusted adults, or support resources, and folks that they consider our mentors or supports in their life. And so we really kind of focus on that. I think finding the right adult or the right advisors for those peer leader teams is probably a bit more challenging. They need to have the right, the right skills, and it's really folks that have good connections with that population group and good relationship skills and can kind of mentor and have a good sense of boundaries and support the peer leaders as they go out and do these different action steps, and really encourage them as they get creative about some of the strategies they're going to be involved with. At the same time, we've got some safe messaging guidelines, so if all of a sudden they're coming up with, kind of some shock and trauma messages, we'll usually pull back and say, those are things that we usually try to keep it pretty, what we call hope and help strength focused. Versus sad, shock, and trauma focused. We try to very clearly steer away from that, because a lot of times that makes our 15% of the students that are most at risk or struggling the most sometimes feel even hopeless, even though those hard stories are sometimes pretty well intentioned. We a lot of times with peer leaders, we talk about having 6 benchmarks, and one of those is having the right advisors, working with them. And I think that, advisors working with peer groups a lot of times can kind of make or break those efforts. They need training just like any group, and having a clear mission or focus. So you're not asking them to go out there and do everything, but you're also not just kind of, there is some evidence that just training peer leaders and sending them out to somehow or another do good just automatically, those really haven't been that effective. We're trying to change the norms and behaviors across the population, across the entire school. And so usually we've got some pretty specific roles as messengers as they're going out and doing that. The peer leaders need to, one of the things, they need to have a say in style, how that's going to look, the wording that's going to be used, the different things that are going to go out there. We need to make sure it's safe messaging and, that it's pretty healthy messaging going out there. And then really providing recognition and honoring is, we find, really critical in kind of maintaining and engaging peer leaders, that they really, we're not interested in nice little peer programs. We're interested in pretty powerful programs, and peer leaders are going to be able to do certain things that other groups are not going to be able to do. And so we need to make sure we give them recognition. I've got a friend up in Turtle Mountain area along the border by Canada, and she picks her recognition event is in a small tribal community with all of her peer leaders as the biggest basketball game of the year. And at halftime, all those peer leaders are coming out and being recognized for their efforts throughout the year as they're doing, positive messaging and all these other things that they're engaged in. And, I think, we really need to be pretty focused on making sure that the recognition and honoring is really meaningful to the peer leaders. So I think the other thing too is really helping peer leader groups measure their success and kind of doing some, really kind of taking a look at the impact that they're having. And, sometimes we'll just sit down and say, hey, do you realize you just got done talking? We'll have a group that you just got done reaching out in the last week and talking to over, 300 staff in the school. And you reached out and gave presentations, to 500 students. And the Facebook and text forwarding messages spread out you actually were able to reach 15,000 folks on your Facebook pages. And kind of by measuring some of those types of things that the peer leaders are doing really also helps them feel pretty engaged, and it gives them a sense of empowerment and really power as they kind of send, kind of these wave after wave after wave of pretty positive messages out there about, life's going to have ups and downs, and there's strengths that we can tap into to make it through that. And those kind of tie in with, certainly with a lot of suicide prevention. One of the things in sources of strength when we're recruiting peer leaders, we just about never lead with suicide prevention. We always will say, hey, we'd like you to be part of a peer leader program. We're going to be talking about a lot of strength type things that help people make it through both ups and downs in life, both staying healthy, but when folks are really struggling, depression, feeling suicidal, struggling with addiction, dealing with bully situations or harassment, we'll kind of list off that. And so we'll bring suicide prevention in as one of those, but we usually won't lead with that as being kind of the front and center piece. We're going to be much more talking about, we're wanting you to have an impact on your friendship group, helping your friends stay safe. We think that you can really be powerful as far as changing norms and cultures throughout the whole school and community, kind of presenting it in that way versus just coming in directly and solely focused on suicide prevention.
Mark, thank you so much. Between your answer to the question and Matt's, I feel like we just covered a whole lot of ground in terms of peer-to-peer based programs, but you identified a number of different strategies that sound like they've been very effective with your programming. So we are going to move on to the next question. Carrie is going to take that one. But in the meantime, I've just been taking a number of different notes and sort of thinking ahead to when we can have a longer discussion about a number of these points. So, Carrie?
Great, thanks. So looking back to trainers, some think that keeping trainers connected might be an effective way to keep them more engaged and involved. So thinking about this, what have been some effective strategies that you've used in connecting trainers to support each other? And maybe we'll start with Donna, since you didn't get a chance to speak on the last question.
Okay. I could start. For the last 2 years, there's been an Assist Trainers Conference in Oregon, and all the Oregon Assist trainers are invited to attend. It's a day-long event. Actually, it starts the evening before. There'll be a small training the evening before, and then everyone's invited to go to dinner together, so we have some social time, and then an all-day training the next day. And it really helps. It really helps everyone know meet other trainers from other parts of the state, and it helps me because I often will know their names, or maybe we help fund them through the Garrett Lee Smith funds, and I get to meet them in person. But it really helps us have faces and helps us connect with one another. After the last training for training, I started an assist trainers listserv. So we have a listserv that's just for assist trainers, and we've got 40 or 50 trainers in Oregon right now. And it's a way to connect with one another, get a trainer if someone drops out at the last minute, or just ask questions. Because of the Garrett Lee Smith funds and our emphasis on Gatekeeper training, we've had a number of our counties train 2 or more people as assist trainers. And when there are 2 trainers in the same county, then they really can work together. And often one of those people will work for the agency that is getting the grant funds, and the other will work for another agency, and they just develop a partnership, and that really helps to support one another. If there are more than 2 in a county, then that's the same case. They can support each other and call on each other and work together. I think another thing that has helped is having the training for trainers in Oregon. Last year, because of Garrett Lee Smith funds, we had so much demand for training for trainers. We had 2 of them. And it's an intense 5-day workshop, and people do get to know each other in that training, so it helps you kind of become buddies when you're in the same training. In QPR, we're not doing so well connecting trainers to support each other. In the past, we've just asked people to do the self-study, and if they're motivated to do it, and they're also required to do it as part of the grant to do QPR trainings, then they keep up with it pretty well. And if they have agency support, some counties just take off. The QPR training engages their other partners in the community, and they hold meetings or gatherings among the trainers. They give them recognition. They give them stipends. They support by setting up the trainings, but the trainers know one another. In the state, I don't know, we probably have 100 Gatekeeper trainers in QPR, and I haven't done very much to help support the trainers. We've talked about setting up a website or a listserv for QPR trainers, and also having a training, or not a training, but having a QPR trainers conference for one day a year so that people can get together. I talk with some of them on the phone, but unless they live in the same community, there isn't a lot of support for each other. It's something that I definitely want to be working on.
Great, thanks so much, Donna.
Yeah.
And to our other presenters?
I guess I would, kind of echo some of what Donna's saying. I think, that sense of being together at a training, I think there's some good relationships that develop through that, kind of train-to-trainer process. we try to bring folks together fairly regularly, like at least every 6 weeks or 2 months, around some teleconference calls where we can kind of talk back and forth. But then also, it's not only, sometimes try to talk about a certain skill, but it also gives, there's a lot of cross-training going on where somebody say, hey, I ran into this, and, with this group, and somebody else will jump in and say, here's what I found really works with that. And, I think the other thing that we're finding is we're using Facebook and Twitter quite a bit, and some of both our adult advisors, our peer leaders, as well as some of our trainers seem to be jumping in and using that. We'll kind of tell some of the good stories. Hey, we just kicked this off in this area, or all of a sudden the school comes up with a great video, or they've got a really, kind of a cool picture of some activity that they've done. And what we try to do is take those and spread those around the country and really kind of use that as examples. And I think those type of things kind of keep people kind of engaged and connected. They feel good that they're being recognized in that way, and their success is being shared as an example, for others in other areas. The one thing I would add, I guess, one of the things I've found when we're working in high trauma areas, like some of our tribal communities, some of our Latino groups, urban settings where we're dealing with a lot of death, and our trainers or our leaders, this isn't an occasional deal, but there's a death happening every month, and sometimes it's in their own families, and dealing with that. We find in those situations, my experience kind of working with statewide projects is it's really important to invest in bringing people together, face to face when folks are working in just that high trauma setting, and really kind of trying to build up a bit of a support base that sometimes they may not necessarily be feeling just in their own, especially if they're in a small community or they're working in a project, and there may be not a lot of other people around them doing that same kind of work. And so if we can bring them together, sometimes every 6 weeks and even every couple months for some face-to-face time together, especially when they're in those high trauma settings, we found it really critical that it really makes a difference for reducing high turnover that often goes on with positions like that in those communities. And, a lot of times our sources of strength wheel has 8 strengths on it. And a lot of times, it's not just talking about the training, but we'll also kind of go around that wheel and we'll talk about, hey, how are we doing personally? Let's just kind of each go around and talk about, hey, where are we at? How are we doing with our own strengths? What are we struggling with? And keeping that very real and honest. And, I think that's really important to kind of build those kind of supports in, especially for our workers and trainers out there that are really living in high stress and high trauma communities, and they're just dealing with it every day, and really have to have that support kind of built in for people to be able to continue very long.
Thanks so much, Mark. Matt, did you have anything you wanted to quickly add? In the interest of time, we're going to need to move on to the next question soon, but I wanted to give you a chance to say a few words.
Yeah, I'll just speak very briefly then. We have the advantage of, it's a program on a college campus, so a lot of these trainers are already connected to each other before we even meet them. We'll wind up training in the same cohorts, people who are each other's fraternity brothers, sorority sisters, sports teammates, roommates, things like that. So some of them come in pre-connected, but I think it's already been touched on, just the idea that going through the training together, and I think we try to cap the group sizes at around 15 or so to promote this. I think there's a sense of kind of bonding that the group goes through that you lose a little bit of if you get a whole lot bigger than that in the size of the training. People start to feel a little more anonymous. And I think we really try to make the trainings go so everybody feels like, they individually are a valued part of the group, that everybody's interacting with each other. It's not just one direction, us talking at them. It's very much all of us interacting together. And I think that's where a lot of the connection is either strengthened or born.
Wonderful. Thanks. I'm going to turn it back to Gail.
Sure. Our next question, I feel like each of you has touched on this to a certain degree in your other answers, but I'm wondering if you could speak more specifically to the sorts of skills or experience you would recommend looking for when you're training trainers or enlisting the help of key leaders. I realize we've been using the word trainer throughout, but that I also wanted to sort of bring us back to thinking about this in terms of key leaders as well. Donna, maybe you could get us started.
Okay, I will start.
I can pick on you.
Oh, sure. It seems like we have a lot of experience in this from when we started recruiting trainers, even before the Garrett Lee Smith, and paying for people to take a training and assist because we wanted to build the capacity in Oregon. And so from an experience of probably the first training, we lost half, maybe a third of them never gave a training, and half of them didn't continue on. So I've really worked on getting particularly assist trainers to how can we get trainers trained who will stay with it. And I think that maybe some of the most important things are that they're motivated. They want to do the trainings because they see a need, because they want to make a difference, maybe because they have an interest or a passion about the subject, but they see a need and they really believe that this is a way they can get involved and do something. Some people want to sign up for training just because it's a training and they think they're good trainers and they like to do trainings, but without some motivation around the subject area and seeing a need, that doesn't really help, I think. We try to get people who also have had experience at least with a longer training or a manualized training, and that's worked really well. For QPR trainers, we get people who can train and who can engage audiences, and it's more important for them to have people who are connected with the community because they can engage smaller groups and more frequently because it's a shorter training, obviously. And when they're already connected to the community, then they can go out there and get trainings pretty easily. The backgrounds of the people haven't mattered so much. We've got mental health professionals, school counselors, educators, public health persons. I'm a public health educator myself. We've had law enforcement. We've had any number of backgrounds from the trainings, but it's the motivation and the sense that they want to do it because they see a need and they can make a difference. I think that's the biggest thing that we're looking for now. And it also helps to have agency support so that they can follow through. That I would say that too.
Yeah, I'd say in source of strength we're looking for, good connection skills and empathy, caring, humor. That facilitation skill is pretty critical for us because it is fairly interactive, and we're looking for people that can lead. That it's not about my story, as the leader, but we're kind of a program that draws strength-based stories out of, especially when we're dealing with middle school, high school groups, that we can draw their stories out, and at the same time, folks that are pretty patient and not quickly engaging in kind of in-your-face type of stuff of middle school, high school. When they're engaged in something, there's a lot of side conversations going on, and people that can be really tolerant and maintain kind of control of a room, but without kind of having to be very direct about that. We can do that by manipulating space and pacing and things like that. So we're really looking for folks that are pretty skilled at being able to handle those kind of facilitation type processes.
For our program, because we're not asking the students once they're trained to be, leading sessions or doing peer counseling or something like that, our policy is we will never turn a student away who's interested in the training. Now, sometimes if we get full, we'll hold people over for a future training, something like that, but we are open to any student on our campus who's interested in the training. That said, in terms of who we're actively trying to recruit, we really want to find people who are kind of well connected with their peers. So kind of who by training them can we be indirectly influencing the largest percentage of our campus. So a lot of times that winds up being, students who are pretty heavily involved in activities or kind of known on campus and things like that. But we also really try to make a very deliberate effort to reach out and recruit from populations where we don't know if we've been having the greatest effect, or where we're not sure if we've been as involved as we'd like. And just, so for example, about a year ago, we did a training for a cohort of international students. We weren't sure if we were really reaching our international students as much as we liked. We collaborated with the head of the international house and, did some heavy recruitment there, trained a bunch, and now we're having a much easier time recruiting from international students now that, a whole cohort of their peers has come through, is making recommendations, is saying, hey, this is something that was valuable for us, maybe you should think about it too. So kind of, trying to make sure we build in the diversity that reflects the diversity of the campus. And we also just did, for the first time, about a month ago now, we tried our program with staff and faculty. And for that, we were a little bit more selective. And the key feature that we looked for in this case was because the goal is to, again, support the student body, who are people who are seen as well connected with students. And we tried to actually ask our Student Support Network students who they thought were staff and faculty that they saw as approachable, who cared, who took an interest in students' lives. And so through that, we were able to determine who we wanted to invite, and we tried again to get a good mix, though, of people from different roles. So we got, some faculty from different departments. We got some student life staff type people. We got someone from campus police. We got someone from facilities who was someone a lot of students came up and talked to. We really tried to reach out across the spectrum, and I think that's probably our biggest recruitment strategy. We want to get people in the room from all different parts of the campus life, and who are going to, in turn, be able to reach out to the people they're connected to.
Just to add, I think what Matt's saying, I think looking for that diversity of peer leaders, there are two kinds of students that we really encourage groups not to recruit into an active peer leadership role. And one is students that have just made suicide attempts. Maybe they're just coming out of a hospitalization, things like that. And our feeling is that a lot of times they just need to get their feet under them, kind of take care of some of their own stuff first. And the tendency is if they come into a training, generally what we've seen is they'll want to take over, and it's like, hey, I know all about it, I've just been through it, and they'll kind of start lecturing at all the other peer leaders. And sometimes they just need some time. We've had many, many students that are peer leaders that have been suicidal in the past, but usually they've got a little bit of time where they're doing better. The other student that will say try and probably don't bring them in are sometimes students that are just really highly impulsive, and they just can't control their mouths sometimes. And so somebody's saying something across the room, and they're muttering some kind of insult under their breath on the other side. Some of the kids just don't have really good social skills that they can handle a group setting. And we usually kind of say, let's not set them up for failure. If they have a hard time being in a group of 3 or 4 people, why set them up to come into a larger group and really have a difficult time with that. So just thought I'd throw that in there.
That's a really great point, Mark. And to thank all of you for your responses to this question. I'm going to hand things back to Carrie for our last question before we move into a bit more discussion and hopefully some questions from participants who have been listening all along.
So for our last question, we want to look a little bit at sustainability. So what's one piece of advice you would give to our participants today on how you could ensure training efforts survive beyond the life of their grants? And maybe, Matt, if you wanted to start.
It would be my pleasure. I'm going to give, well, I guess it's one piece of advice, but I'm going to branch it in a couple of directions. And the first one I'll say is just make sure people know what you're doing. And if it's working, make sure people know that it's working. I think we've made a real effort to be visible in the training we do, and to let kind of key administrators on campus, kind of decision-making sorts of figures, know what we're doing and how it's going, and really, and not just them though. We really try to build ourselves in as this program is kind of a fixture of the campus culture. We want students to see us that way. We want the staff and faculty to see us that way. We want our bosses to see us that way, so that when the grant money does go away, there will be the sense of, well, this is something we don't want to lose. This is something that's kind of a part of who we are here now. So we do as much as we can to kind of do that. And also, we really are invested in having the work that we're doing have a life beyond our campus. And to that end, we've really tried to make an effort to make our manual and resources like that available to anyone else who wants them. In fact, if you are interested in getting the manual for our Student Support ERIC program, you can email me after the webinar is over. We'll make sure you get a copy. It's no charge. We're very open source about everything we do. But we want to see this happen on other campuses, and I know BU has started adopting it. Mass Bay Community, Maine is doing similar work. Towson. So we want to do what we can to give this program, no matter what happens on this campus, and we hope it stays and it thrives here. We'd like to see it have legs and really just grow and thrive anywhere that it could help people. So that seems to be our major focus with sustainability at this point.
Great, thanks, Matt. Anyone else like to share?
My one piece of advice would be to institutionalize it. If you have Gatekeeper trainings in place, get them institutionalized, and I think they will continue for a long, long time. A couple of ways that they're being institutionalized here is it's a requirement for mental health professionals who see clients in one county, and I keep emphasizing that, hoping that other community mental health agencies will pick that requirement up because they've seen the value in it. They've seen such a strong value in it. And also as a 4-credit college course, getting ASSIST or QPR as a 4-credit college course is another way to institutionalize it. Schedule ongoing trainings in a community so people expect it. My experience is that once, especially with ASSIST, is once a community is exposed to it, then more and more people want it, and it creates a higher demand. So we've been creating the capacity. If we can get it institutionalized, then I think it'll go on for a long time.
Thanks, Donna.
Yeah, I would certainly echo what Donna just said, and that if you can weave that in somehow into the system. I guess the one thing that I found with peer leader programs with our source of strength is we would say if you want to sustain it, you get those peer leaders like in middle school, high school programs, get them in front of the community or the school adults. And so it's like, take 4 or 5 of those peer leaders and have them go into the monthly staff meetings and do a 3 or 4 minute update to the school staff and tell them what they're doing. They can sell that program like nobody else can. Take them to the school board. It makes the superintendent and the principal look really, really good, and their level of buy-in goes way up. Get them in front of the Chamber of Commerce. We found the checkbooks start opening up. If you bring those peer leaders in, they start telling what they've been doing. Chamber of Commerce all of a sudden is buying in and saying, what do we need to do to help you sustain this? This sounds like a great deal. And so I think really getting in at a college level, again, who are those key stakeholders and who are folks that are decision makers, and get those college-age peer leaders out there and presenting to those groups, I think would really help. The one other thing I'd throw in there is measure your effectiveness and, kind of pay attention to some outcomes. And I think that needs to be a mix of, having some good data, but also you got to have some stories of the heart. And you need both. And so, if you can walk in with some good hard outcome data as well as some really good stories about how this has really impacted somebody's life, that can be a pretty powerful combination. The other one is, prevention these days. It's just all about change, and we got to constantly be switching partners. And for suicide prevention, folks, my message would always be, you got to think beyond suicide prevention, and we got to partner with violence and bullying and mentoring and foundation and individual donors, and we really got to be quite flexible and adept at who we partner with, and what you start with 5 years later, that's going to be a different set of partners. That's just kind of the name of the game these days. So,
thanks so much for all your great ideas, guys. So I'm going to turn it back over to Gail for some Q&A and discussion.
Thank you, Carrie, and thank you to our panelists at this point for really providing us with some succinct but also pretty comprehensive responses to the different questions that we posed to you. We really appreciate that piece of the dialogue. And at this point, we are going to open up the virtual floor, so to speak, to questions that participants might have or comments. And I know that we've had a couple kind of trickle in while we were having the conversation, but this is your big opportunity to ask whatever is on your mind related to the 5 questions and set of answers that you just heard, or something else that was on your mind that you brought to the webinar that you didn't quite hear answered yet as it relates to engaging and motivating trainers and trainees. And also thinking about sustainability, since that's really framing the conversation today. We have one question that came in before. It was a clarification question, and it had to do with a line from a description of the QPR training, whether I believe it was, did he say? So it was either you, Mark, or Matt, who said something about hope and health versus hope and help.
It might have been my comment about giving hope, help, strength message versus sad, shock, and trauma stories.
Okay, great.
Is that it?
Yeah, I believe so. Sorry. I guess it wasn't QPR after all. Okay, yeah, I think that answers the question. Thank you.
Yeah, and I think that the concept is that, if we're out there just telling trauma stories, we can actually be kind of creating a norm sometimes, especially when we're working with youth populations, that, we got to be careful that we're not giving the message that everybody is suicidal and we're creating that norm that everybody is. Rather, we want to talk about, some folks go through this and life does have some ups and downs, and here's the strengths that people tap into. Here's how folks get better. And I do, as we take some time to talk about risk factors and warning signs, but actually in our program we spend quite a bit more time talking about what are those strengths that people, when they're going through tough things, how do they make it through those? How do they get better and get more healthy? And we find that we kind of need to keep things fairly heavily focused on that side for some of our young audiences.
Great. Thank you, Mark, for clarifying. Okay, there's one broader question that I have for the three of you, or that we have for the three of you. But there were two questions that came in that were specifically for you, Donna, so I'm just going to start out with those first. They had to do with QPR and Assist. One question was whether or not you've used the QPR Institute to support your instructors. And then the other one was about, it had to do with Assist, and I'm going to look for that question now. So if you could speak to the QPR one first, that would be great.
Okay. Yes, that's a really good question. And yes, we do look to QPR Institute because it does support instructors. And I should have said that. They send out training newsletters, and their website is a good support. And I can always call their office or even Dr. Quinnett and get help if I need it. And the trainers know that as well. So yes, I definitely use QPR Institute to support our trainers.
Great. Okay, and then the other question that had to do with Assist was whether or not you offer guidance for your Assist trainers on priority groups to train. In other words, do they screen for people who are likely to encounter and be trusted by at-risk youth?
We market it, or it's promoted to people in the community who work with youth. They're not screened in any way because the trainings are pretty open. We really target mental health professionals, school counselors, educators. We try to get emergency department, social workers, or other staff. We get law enforcement and EMS people, nurses. We get in schools, we try to get people who the kids naturally gravitate to, regardless of who they are. In fact, we have a school program that requires there to assist trained people in each school if they're implementing the response program. And they're often school counselors, but not always. And we ask them to be really careful who they select. We had one school that wanted the principal and maybe the superintendent wanted to become the assist people, and I don't know them, and maybe they're great, and maybe they are people that the kids gravitate to. It's a really small school. And so I just wrote back and asked those questions to make sure that you're setting it up with people who the kids will go to, and not that the administrators aren't a barrier to that implementation. So in that case, we look at it pretty carefully. In the other assist trainings in the community, they're open and they're broad, but we do target those specific groups and do outreach to them.
Just to kind of add to Donna's comment, in our training with peers, and we have middle school, high school, college, one of the last things we're doing is we're going around a circle and they're naming adults that they would turn to. And so we would say, okay, who do you have in the school or on campus? Who do you have out in the community? Who do you have at home? And so they're writing some of these down, but they're also sharing, as we go around. All of a sudden we start hearing, I go to my mom. And then the next one goes, well, I go to her mom too. I go to her mom too. I go to her mom too. We start hearing, not just people that are in counseling roles or in helping roles, but all of a sudden you start hearing those kind of names coming up over and over again. Those are the ones that after training we would say, hey, let's get them plugged into the next assist training. They're really highly connected. They're very, very likely to be in the middle of suicide crisis. And so that would be one of the ways that we would try to connect with those kind of gatekeeper models as well.
Great.
I love that. This is Donna. I love that. Thank you.
Okay, there's another question that came in. Like I said, this is a broader question, and the three of you can certainly speak to it. But I think it's also something that we've talked about a little bit throughout the webinar today. And basically this has to do with the term gatekeeper itself. And I know that when we had some initial planning conversations for the webinar, we talked a bit about how, this isn't a term that that is necessarily used when presenting this kind of a program. And it really doesn't, it's not a good fit sometimes for describing certain trainings that might get lumped under this umbrella, or for presenting these types of training to people in certain communities, because it can be a bit of a hurdle, and it can be off-putting because it might imply keeping someone out rather than helping someone to get help. So maybe we can talk a little bit about the use of that term as it relates to the trainings that you all offer, whether it requires an explanation, and if not, what term would you use to describe the trainings that you use?
I know for us, we might use the Gatekeeper training when talking with peers or internally in our office, but it's not a term we're using with the students. And I think maybe it is because it does kind of have some clunkiness to it. It may give people the wrong idea, or at least if not the wrong idea, maybe just some confusion about what it means. If we had to choose a thing to say, we normally just call them our SSN students, but we might call the training more of like a peer-to-peer initiative or something like that, a peer-based training. But yeah, generally Gatekeeper, agreed, it really isn't a term that we're using a whole lot, at least with the students.
Well, I think source of strength. We kind of get described that we had had this conversation before. We really don't see ourselves as a gatekeeper training program. We have a gatekeeper component in that, but it's not the core piece. We'd probably be considered more of a health promotion. We have a prevention piece. Maddie Gold from Columbia was presenting on school-based programs and kind of said, source of strength really kind of fits a few different categories. And our primary role isn't to necessarily put peer leaders out there and have them engaged in just identifying suicidal students and connecting them with adults. So that happens a fair bit. But we're really about trying to get in front of suicide, and we're trying to have them spread health messages that get to people before they become suicidal, that they can tap into these multiple strengths and supports that can help them before they get to a point of becoming at risk for suicide. And that's really kind of a primary goal in our program.
And I will agree with the person who wrote the question. I think it's kind of a clunky word, and we don't use it. I do think that it's on our website. We call the suicide intervention skills trainings, but that sounds like big bureaucratic. To me, it sounds like a big bureaucratic word. I would love to have a simpler way to describe it. And if I'm talking with someone about Gatekeeper trainings, I will call it suicide intervention skills training and explain what that does in more simple language so that it's understandable. If anyone comes up with a new term, I'd love it.
I think you're not alone in hoping for a new term either.
Thanks, guys. So we're running towards the end of our time, so I just wanted to see if there were any final questions that people haven't typed in yet. Please do that now. We have just a few more minutes left. So this question would be for, I believe, Donna. So one person writes in that they find the ASSIST two-day training is difficult for staff and community members to commit to. It's too much of a chunk of time, even for trainers. What's been your experience?
My experience is we get people saying that frequently, and then once we'll get it from mental health professionals, say, just for example, because school staff will say it, and probably every population will say, no, we can't spare the people for 2 days, it's too much. And then they'll experience the training and go back and tell others this training is really important, you have to take it. And so once people have experienced it, we don't have that complaint. But before a community or a school has had much experience with assist, then we get that complaint much more frequently. I'm hearing it less and less as a barrier all the time as we build more and more trainings throughout the state. I'm really happy to say that. But it's hard to get past that initial resistance to get into a community or a school. We require it of schools implementing the response program. So schools, because they already agreed to implement the program and they know they have to get 2 people trained in assist, they have to do it. They might not like it, but what happens is then they send the next training, they'll send 5 more people, and they'll send a bunch more to the next one after that. So it's the initial reluctance and the lack of familiarity with it is what's been the biggest barrier in my experience.
Great, thanks. And to our other panelists, would you like to say anything about overcoming the time constraints and barriers like that?
Well, I guess I think again it depends on what group. You certainly have to kind of find. I know in our program, we consider it more of a comprehensive wellness approach. It takes a fair amount of time commitment and effort by a school or community group or faith-based group. The one thing I think around, I guess I'd like to say, I think one of the things we're seeing in the research on Gatekeeper training is, let's say if you need to have something shorter if you want to train the whole school staff, and so you may come in and do something basic on warning signs and referrals. But I think it's important to have in there something that identifies who's your go-to person in your building or who's your go-to person in your agency. You get a physics teacher that they may get a Gatekeeper training, but they're maybe really kind of going, this is not my job. And I really don't feel comfortable asking a student that's suicidal or that I might be worried is suicidal. And I'm more than willing to kind of watch for risk factors, warning signs, but can I make a handoff, and just emphasizing who's your go-to person, who can you make a same-day referral to, don't, carry it overnight, things like that. I think what I think we've seen is that kind of handles some of that pushback sometimes that has come out of some of the research on some of the Gatekeeper studies, especially in school settings and things like that. So you need to be able to, you can get involved and ask the question, but also if you're not comfortable, you can go to somebody and identifying clearly who that go-to person is can really help that process.
Matt, any few words you want to say on that before we move on?
Sure. I think, with kind of any of these programs that you can do, I think a lot of times it comes down to just, how are you marketing it? How are you putting it to people? Because I think if someone comes away with the sense that this is something that's going to be really valuable for me, it's really speaking to my needs, to my interests, they tend to be able to find the time. When maybe if it was presented differently, maybe they wouldn't. And I think so that can be a big piece of it, And they say, you want something done, you ask a busy person. So, and we're asking very busy people to take on a little bit more here. But I think when they believe in it and when they feel confident that this is something that's going to speak to them, that they're willing to find the time.
Great, thanks. Well, I'm looking at the time now, and unfortunately we're going to have to wrap up, so my apologies if we didn't get to your question. Please feel free to email either Gail or myself with your question, and we can try to find that out for you. But so here we wanted to provide you guys our contact information and the contact information for our panelists today. And as Gail mentioned, the webinar will be archived on our website and the campus grantee private pages, and we'll also send out a message on the listserv once we've posted everything. Also, be on the lookout. I will be emailing you a survey in just a few minutes where you can provide feedback on today's event. This survey will only take a few minutes to fill out, and we always appreciate your feedback on how we can make these more useful for you and your teams. And unless there's any final questions, we want to just give a big thank you to our panelists for a really interesting discussion and their time, and thanks so much, everyone.
Thank you all so much.
This will conclude today's conference call. You may now disconnect.
Great.